Hi, I'm Dr. Julie Steinauer. Can kids really get concussions? Yes, they can. And you really have to be careful about this because kids getting concussions, they tend to want to play through things or shake it off and say that they're okay and get right back into the game. So you have to be very protective of your kiddos. Now, before we get into talking about this, I want to share with how you can connect with us. If you're local, call us at 618-288-1489. If you're not local and you're somewhere else in the world, you can go to our website at visionforlifeworks.com and you've got two options. You can click on the schedule a consultation button if you know for certain that you want to schedule a consult with me, or if you'd like more information, what you can do is you can click on the questionnaire and fill that out, and we'll start the process of emailing back and forth with one another, and our clinic will talk with you about how we might be able to help you. All right, so let's back up and talk about concussions with kids. Doesn't really matter what age you are, you can suffer from a concussion. And obviously you can go look up signs and symptoms of concussions on the internet. But what I want to talk to you about is, what do we do about it? What if your child sustains a concussion because they were playing volleyball and they got cracked on the head by an elbow that came down, or maybe they were playing baseball and they jogged themselves, or softball, and they jogged themselves as they were sliding into the base. Okay, there are lots of things that could potentially cause your child to have a concussion. And if you've noticed that, your child is not really kind of snapping back and right back at their normal things like they kind of normally would, then that's a sign that they're having post-concussion vision syndrome. There's lots of symptoms associated with this. There could be things like double vision, disorientation, dizziness, trouble using the two eyes together, blurriness, just not wanting to read or disconnecting between what they do read and what they remember, struggling with the memory. Again, lots and lots of symptoms you can go read about. But you need to know that there are things to do. Part of our kind of battery of things that we can do to help your child, okay, is we use photosyntonics, or also known as just syntonics light therapy. Those goggles, kids can wear those depending upon what visual issues they have. And obviously post-concussion, we need to try to allow the brain to do some healing, and there's specific goggles that are actually designed to help the brain to go through the healing process after a concussion or other type of traumatic brain injury. So we can use syntonics to kind of help heal the brain a little faster. Maybe use syntonics also to trigger the brain how to use the two eyes better together as a team. Maybe even help with getting rid of some of that light sensitivity. And there are many other things that we can do. In addition to syntonics, we're going to use vision therapy, which is a bit more mechanical in nature, to train and treat your child's eyes and how the two eyes work together with the brain. So as you can tell, lots can be done. And if you're the person who says, well, I don't really want to sit around and wait and see what happens, I just need my child to be back to fully functioning, well then, two options. You can either call us if you're local at 618-288-1489, or you can go to our website. Now from there, you've got two more options. You can either fill out the questionnaire and begin talking with us via email, or you can click on that consultation button and schedule a consultation direct with me. Now if you like this video, then hit like, subscribe to our YouTube channel, and certainly pass it on if this information is not appropriate to you, but you do know someone who could benefit from it. Thank you.